people may imagine that recession has to do with age. And the older or more mature one gets, the more prone they are to developing recession. That's not the case at all. I can tell you that we're treating recession on 80-year-olds and we're treating recession on 80-year-olds. So age may be a factor on traumatic habits that accumulate over the years, if that really is the cause of a recession. But in reality, the main cause of recession is somebody who genetically starts with very thin bone around their teeth and very thin gums around the teeth. Imagine it like a real estate. If the real estate is limited because the jawbone is very, very thin, these are the same individuals who at some point of their lives, they needed some type of orthodontics treatment. And in order to decrowd or uncrowd the teeth, put them nicely lined up in the jawbones, these are typically the same individuals who started with kind of a smaller jawbone and smaller tissue covering that jawbone. So over time, as those individuals mature, or even immediately after orthodontics, one may notice that recession is starting to form on one or two or several teeth, and the gums are getting thinner. What the patient sees as recession, as you see in this case right here, is that exposed root surface. And they're thinking, oh, my tooth looks so much longer than the neighboring teeth. That's what the patient sees. Typically, many times, that's what the hygienist sees and or the general dentists. But for us periodontists, we're looking at this and we're thinking, I do see the root that's exposed. That is a concern to me because that means bone loss on that tooth. I'm also seeing how thin and flimsy and frail is the surrounding tissue, not only on that particular tooth with the recession, but also on the neighboring teeth. So when we treat recessions, we have three goals. Of course, we want to cover the exposed root. Why do we want to do that? Because if the root is exposed, that tooth will wear out. That root may get sensitive. That root is more likely to get a cavity. In other words, the white part of the tooth, the enamel, is much harder, and it's made by design to be exposed in the oral environment, which, by the way, is very harsh. The root structure is not the same. It's very, very soft. It's made to be insulated by bone and gum on top of it. So if it's exposed, it's much more prone to having damage down the way. So the goal is, number one, to cover that. The second goal is to cover it with a kind of tissue that's very firm, the kind of tissue that almost creates like a turtleneck around the tooth. That basically seals the tooth properly, and it prevents bacteria from going down into the supporting structures, into the periodontal ligament. The third goal is not only have tissue that's firm, but also have tissue that's thick. Because the thicker the tissue, the more resistant it is to future recession and the progression of recession. You can see actually in this first case, not only is the root exposed, but also the tissue on the neighboring teeth is much thicker. Not only that tooth was grafted, but also the neighboring teeth to protect them for future recession. In this particular case, it is really the volume and the thickness of the tissue that will support the teeth as this individual is maturing and progressing in life. So yes, it's an outstanding outcome because the root is covered, but in the eyes of a surgeon, in the eyes of a periodontist, this is an even better outcome because all the neighboring teeth don't have this very thin, frail tissue that's paper thin covering them, but they have more robust, more thick tissue to protect them long term. So as a summary, and I'll show you one more case here, recession can strike anywhere in the mouth. You can see it visibly on upper teeth, like in this case right here, where you can see recession forming on the roots, on the gums of this young person. We want to cover all that. And the earlier we catch recession, the better our outcomes are. Because covering exposed root surfaces has to do with how much bone loss there is in between the teeth. It's almost like setting up a hammock. If the trees are pretty tall, it allows you to bring the hammock pretty high up. And that means you can cover completely and undo all the damage that's taken place. If we leave it for too long, we may not be as successful, and we may have to compromise into just accepting thicker tissue and not any further progression without being able to rebound from the existing damage. That's why I'm not a big fan of any type of let's watch it type of approach for recession. We need to be proactive, and especially if you see recession on a young individual, that's another reason to be even more proactive, because that tells you this individual has a lot of decades to go. And if they already are having a recession in one area, what's the progression of that, more likely they're going to have recession on other areas, and the recession, the area that's already receding may actually get significantly worse and or compromise the tooth itself. So one more case I'd like to show you. The last one is this third case. And you can see on the upper left picture how much thicker the tissue looks comparing to the receding thin tissue on the lower left picture. That's the before on the lower left, and that's the upper on the upper left. It's that thickness that provides that bulletproof vest around the teeth to prevent any future recession. And you can see the same case before and after, top to bottom, how the before was, how thin the tissues were, and how exposed the root surfaces were, and how we can really insulate them and protect the teeth. Notice also in this particular case how crowded the teeth are. That's what I was trying to point out previously. These are the same individuals who at some point of time either needed orthodontic treatment or need orthodontic treatment because there are just too many teeth for the real estate that's present in terms of bone and tissue. And that, if you're seeing recession, or if your dentist and or hygienist are pointing out that you may have recession in your mouth, that's definitely something you want to get checked by a periodontist and or treated by a periodontist. And as far as treatment goes, I get this question a lot. I don't want to use my own tissue. I fear that hurts. Are there any other solutions? And the answer to this is every case, every site, every tooth in the mouth of the same person may require different treatment. Some teeth may require, indeed, utilizing the patient's own tissue where you can be your own donor. And guess what? It is not as bad as it used to be 10, 20 years ago. Thankfully, our techniques and instrumentation has significantly improved. Other cases, we may be able to very successfully utilize other products, such as human donor tissue. Now, what is that? Is that a transplant? No. Am I getting anybody else's living cells? No. It's really just a matrix or a scaffold that we utilize. It's completely sterile. It's from tissue banks here in the United States, highly regulated products, and it's your own cells that have to colonize this matrix and create new gum. So that's the donor tissue. But many cases we can utilize donor tissue, other cases we prefer to utilize your own tissue. As upcoming frontiers of that treatment, there are also synthetic products, and we're looking into those. The reality is probably 80 to 85% of the cases, we would guide our patient to either utilize their own tissue, currently, and or donor tissue. Indeed, another advance that we've made over the past few years is utilizing growth factors. The patient's own growth factors to really super boost that initial healing that's required by any type of soft tissue procedure. And we can do that with what we call today platelet-rich fibrin. We can harvest that by borrowing a little bit of blood from a peripheral vein, very much like when you go and give blood for your annual physical. So by borrowing that and centrifuging it with a special machine in special settings, we're able to isolate growth factors that come from your own platelets, and we can mix them together. And now really that tends to heal very, very well, much faster, and cause significantly less discomfort as documented in recent studies. So a lot of advances, great opportunities. The message is let's be proactive about recession because recession means bone loss.